Hey guys, so I have Dr. Gerianne Lewis on here with me, and today we're starting the Ask an Expert series. So we are going to dive into pregnancy and postpartum exercise and health and wellness. So this is a topic I'm so excited about, and I'm so excited that we have Dr. Lewis on here with us. She is a doctor of physical therapy, and she's also a pregnancy and postpartum exercise specialist, which is so incredible because I feel like so many women don't know where to start with this. So excited to have you on and can't
Thank
wait
you.
to chat about all of that.
Yeah, thanks for having me. I'm so excited to be here. And I feel like there's so many things that I wish I knew before I had my son that I'm like so excited that I know now. And I try and tell like as many people as I can. Like, this
Yeah.
is what you can know before you're pregnant and after to just have like such a smoother birth and recovery.
When I was pregnant, I didn't really know anything until I started having sciatic pain. And she started telling me, oh, there's other things you can do. And so that's where my journey began. I was already like pretty much 7 months pregnant. So I didn't know
Right.
anything prior to that. And then knowing what I know now, I'm like, okay, there are things you can do during pregnancy, right? That
Right.
help make not only birth easier, but also postpartum.
It's almost like a trampoline. So that's one of the big things I start people with is learning
I did not
how to
realize.
do that correctly. Like, can you feel
Yeah.
your ribs moving when you're breathing? Can you feel
Yeah.
your back moving when you're breathing? And that alone, like I used to never really focus on breathing, but just deep breathing and 360 alone has shown to help with things not even related to pregnancy, like back pain, neck pain, stress. That the easier it'll be towards
Is
the end
it
of your
like, do
pregnancy.
you breathe in through your nose and then out through your mouth, or kind of is there like a certain,
Yeah, so when you're doing the deep breathing, you can do it in through your nose for a nice inhale and then out through your mouth. And then when you exhale, that's when you should be feeling your pelvic floor lift up. So like
yeah,
that area should come away from your chair. Like if you can
okay,
feel your bottom on the chair and then your
yeah,
core engaging like deep down.
okay, I love that.
Yeah.
That's like such a simple one too, right? It's like something that you can actually do every day, which I love. Because so during pregnancy, I remember being told that at a certain point, I needed to stop doing certain exercises. I was told two kind of separate ideas. One was like, do any exercise you want whole pregnancy. If you've done it prior, you can keep
Right.
doing it. I lived by that. Okay. So I was
Yeah.
like lifting normal, doing crunches, doing everything. And then I started to develop diastasis recti later on in my
Right.
pregnancy. They could kind of feel it coming on and afterward. And then later I learned that you're not really supposed to do like crunches or anything that like separates the abs. Is that true? And also then if it is, like when in your pregnancy do you start changing your workout?
Right. Yeah. So it's going to be different for everybody. So there's not like one cutoff time of when to stop. So with diastasis recti, like if you start to notice that coning or bulging,
Mm.
that's when it's time to modify. So there's
Okay.
no one exercise that's a bad exercise. There's ones that are more likely to load the front and kind of put more pressure on that area. So things like
Yeah.
planks, push-ups, crunches, those are more likely to put a little bit more
Okay.
pressure through the front. But if you can do them correctly, so making sure you're using the right muscles. So using
Yeah.
that, have you heard of the transverse abdominis?
No.
Much.
Maybe.
That's your deep core muscle. So
Your what? Core
it's
muscle?
like, yeah, it's one of your deep core muscles. So if you
Oh,
picture your abdomen here, you have your six pack muscle here, but then deep to that, you've got your transverse abdominis and it runs this way. And it's basically like our corset around the body and like
yeah.
almost it gives us our abdominal canister. That's what you really want to focus on with doing core exercises, not that six pack muscle. So if you know how, if you're doing your exercises and you're getting that increased doming, the first thing I tell patients is one, try and teach them how to engage the right muscle. If they can do their exercises without getting the doming,
Yeah.
then you're good to keep doing them. But
So
if you're
that's the
feeling
goal, is
something,
not to see
yeah,
like it making kind of a dome on top of your stomach.
right.
I got
That's a sign to modify that exercise.
okay.
And then if you can't do it correctly with the adjustments, then it's not worth it.
Yeah.
Yeah.
So another thing that I want to ask you about just personally, I myself and some of my friends had sciatic pain really bad once we started getting a little bigger, like once your belly starts getting heavier. What is the reason for that? And can you do anything to like combat it or prevent it?
Yeah, there's definitely things that you can do. Were you having pain down your entire leg, like the whole numbness and tingling
Not fully,
type
just
thing?
kind of like up in my glute and a little bit down my leg. Not
Okay,
fully.
yes. So it really depends. Like there's a lot of things that feel like sciatic pain, like the nerve, or really it could just be
Yeah.
the SI joint. So when you're pregnant and your belly grows, I'll bring my span out again, you'll feel you start to get into that, like this lovely posture.
Yes.
That's gonna put, so if it does cause sciatica, the nerves run out of each of these areas.
Uh-huh.
that is putting more pressure on the nerve. So as we get into that more extended position over time, you're putting more pressure on the
Okay.
nerve. So everyone's treatment is going to be different. So really just trying to find ways to alleviate pressure from the nerve. And then
Yeah.
the nerve also runs out this way. So if the muscles in the glutes get tight, that
Yeah.
can be causing it. And then we also have the lovely SI joint, which can cause pain. So there's so many different causes of it. So it's
Yeah.
really different. Everyone's treatment
Depends
will
on
be different.
the person. Yeah.
Yeah.
This is random. Is it true that your like ligaments get looser when you're pregnant?
Yes. Yeah, and that's why a lot of these things start to happen. So our
Okay.
body releases more hormones that relax our joints and ligaments to make room for
Yeah.
the baby coming out, and then that's when you can get like those little hypermobility or instabilities.
I broke my foot when I was 9 months pregnant, just standing up, fell off my shoe a little, like it snapped in half fully.
Oh,
And I remember like being like, oh, I don't think it's broken, whatever.
yeah.
I'm not act like I think I'm fine because I was so worried
Yeah.
about it being broken. Like 12 hours later, we go to the ER, it snapped in half. And the
Oh,
guy didn't believe me. He was like, you sprained it probably. I don't know if you actually broke your foot like 9 months
yeah.
pregnant. I did. And I'm
Yeah.
like, I think it's because maybe, I don't know if things get looser in your feet too, or like, how does that, are people more prone to like, do they need to be more careful, like breaking things?
I would definitely be, I wouldn't say you're more prone to fractures. It's more so the ligaments and joints that become a
Okay.
little more mobile. But it could be, if you were in like sandals that weren't the most stable shoes, like you probably were maybe a little
That was
more
it.
likely to roll your ankle.
Yep. That was it.
Or
They were like platform sandals with like the front part braided and my feet
oh yeah, I
always
remember
got
you had
stuck.
those like when I first met you, and yeah,
And
and I
you're
ended up
probably like,
getting
why is she
them,
wearing
but
these?
yeah, yeah, and your
I'm like,
balance is
I'll never wear a platform ever again when I'm
never
pregnant.
again.
Like I'm maybe not even a heel because I'm terrified of breaking my foot again. And it was
Not
not
ideal.
not
Yeah.
ideal. Are there certain exercises that you recommend not doing while you're pregnant? If there's like
Again,
something you could pick, like don't do.
I would say anything where you're at risk of falling, like, or like
Oh,
falling on your belly, like, or certain things that may put your balance at risk. So being careful that you're not doing
yeah.
something like crazy, like plyometrics or jumping where you're at risk of falling over. I would probably be a little more hesitant about that kind of stuff.
Because I love that you promote on your page lifting
I love,
and you
yeah,
promote Pilates because that's
yes.
like, I love both of those things.
A Pilates reformer at our office that I use with patients because I just love the reformer.
Yeah.
And like there's certain things I won't put my patients on. Like I'm not going to put them standing on the reformer doing lunges when they're 8 months pregnant because if they
Yeah.
fall over, like
Right.
that's a problem. But otherwise, like it's just modifying the exercises to what they can do. Like I've got someone who's 38 weeks pregnant and she's still deadlifting like a 45-pound
Okay.
bar.
You can do it. It's just kind of
Yes,
depending on your limit and your comfort and
right.
how you're
Like
feeling too.
if you've never deadlifted before, I wouldn't say, hey, let's start learning how to deadlift while you're pregnant. But if you're doing it safely, you're not having any, separation, any pelvic heaviness or pain with
Yeah.
it, then let's keep doing it as long as you can safely and
Yeah.
effectively.
That's good to know. Do you think that like lifting and strengthening the core helps with birth in terms of like how fast you are give birth or how
I
quick?
think it'll definitely, I mean, if you think about like the labor in general, it's like a marathon. So I like to think of it as like getting strong for delivery and afterwards. So there's a lot you can also do, birth prep wise, like certain
Uh-huh.
positions that help lengthen the pelvic floor. So when you think about wanting a nice smooth delivery and pushing process, you want the pelvic floor to lengthen and get out of the way. So let me move this first layer of muscles. So our baby's got to come out of this area of our pelvic floor. These are our pelvic floor muscles. You want them to lengthen and move out of the way and make this nice
Mhm.
big opening for the baby.
Yep.
So again, learning how to deep breathe, how to relax your
How to
pelvic.
relax the muscle down there.
Yes. Yeah. Your
Wow.
uterus is what's pushing the baby out. Like, yes, you push during labor and breathe and exhale, but your uterus is doing the work. You just want
Yeah.
to teach the muscles how to move and get out of the way. So I
Wow.
think those are things and like certain positions and stretches. So doing child's pose, doing deep squats, all of
Okay.
those kinds of things help get the pelvis
And
ready
do
for
you
delivery.
do those like all pregnancy or kind of more towards the end?
Those ones you can do. So you can do them, child's pose, cat cow, deep squats. Those might feel great for certain tightness or pain, but definitely towards the end, I would say daily, like last 5 weeks, like doing those daily,
Yeah.
other certain exercises to get your pelvis ready.
Okay. I love
I wish
that.
I knew that when I was pregnant. I'm like
I
excited
know.
to get out next time and be like, all right, let's see how this one
Oh,
goes.
next time is going to be so different. Like knowing what I know now and having already given birth, And like
Right.
learning those things way more now. I'm like, oh, I know how it was. I'm like, oh, if I can figure out a way to make them come out easier, I will be doing
Right.
that the
I feel
entire.
like I went into it like so blind. I had no
Yes.
idea. Like I would look up a few
Same.
YouTube exercises like how to induce labor or like,
Yep.
but I went in with like not a clue. And like I should know better because I'm a physical therapist, but like unless you really take the time and learn about pregnancy, postpartum, and the pelvic floor, like
Yeah. You don't know. And I like that was something I didn't know at my regular checkups. It wasn't like anything anyone was telling me. And so I didn't know until I started having pain. And then I went and then I found out, oh, there's
then
like
you
other
learn.
things
Yeah.
you can do. And I'm like, that's so cool. Is that what got you into it? Having your son?
Yeah, so I kind of knew like a little bit. They teach you about the pelvic floor for like 2 minutes in school. So it's kind of in the back of your mind, but then you
Yeah.
go on and you forget about it. And then I had my son at the end of 2022. And at this after the 6 weeks appointment, they were like, all right, you're good to go, like get
Yep.
exercising. So I hopped on the reformer. I like, was like, oh, let's do everything I used to do. And then like a day later, I was back in the OB's office. I'm like, something is wrong. I was having a ton of pelvic pain and pressure, and it
Wow.
was like a little bit of prolapse. So she was like, oh, you can go see a pelvic PT. Like it might get better, it might get worse. And like that was
Yeah.
that. So then I went to a few visits of pelvic PT myself and I was mind blown. I was like, oh my God. I'm like, I'm missing the boat here. So that's when I just started learning and taking all these courses. And like now I keep finding more and more things to learn. I'm like
I
so
love
excited.
that. And that's why I love your page because I'm like, there's so much great educational content on there. And you actually do the
Thank
exercise on
you.
video because that's another thing. Like you can look it up all day and it says to do
Yeah.
something, but until you really watch someone else do it, I
Right.
think it's hard to know what
Yeah.
to do, right?
Yeah.
I have another question for you about pregnancy before we move on to
Mhm.
postpartum. I don't know how to say it. Perennial
Irony.
massage.
Yeah. Yes.
Does that actually help like get that muscle relaxed and
Yeah.
just
And it can also help reduce the risk of tearing. So
really?
yes.
It does. Okay.
Yes. I was actually just
Well, I
showing my
was too
patient like
scared to
on
do
the model.
it. So I didn't do it.
I didn't do it either because I didn't know about it yet. But now I was like just telling one of my patients who's 38 weeks about it and like what to do. I was like, I took out the model. You could do it,
Yeah.
yourself. Your PT can do it. You can use a pelvic wand, but you're basically just, stretching that muscle and
Okay.
getting it ready because this is where you're likely to tear
Yeah.
in
When do
child.
you start doing that?
You
Towards the
can start again, like always get your doctor's approval, but like around 35 weeks on
okay.
starting it.
Yeah, I didn't do it because I was like kind
Yeah.
of intimidated. I didn't know what to do. And I just heard it and I was like, oh, I
Yeah.
didn't
It can
want
be,
the
yeah,
PT to do
pelvic.
it. And I
Yeah.
was like, I didn't do it myself. And then now looking back, because I
Well,
tore, I would
next.
we'll be doing it next
Yeah,
time.
yeah,
I'll do
yeah. It
it
can definitely help. It can definitely help reduce the risk of tearing, the severity of it, and then
okay.
also staying hydrated at the end of pregnancy. So
It's a good one.
hydration will help with the tissues, but it's what you were drinking like 48 hours beforehand. So
Okay.
you don't know when the baby's gonna come. So staying
Right.
hydrated, like
So just
all
always
throughout. Yeah,
okay. Last pregnancy question.
you're good. You're good.
Okay. Pressure points. Like, is that something that actually you think can induce labor? Like pressing on them? I did it right before I gave birth and I like
They
have
say so, like, when we do our dry needling training,
uh-huh.
they tell us, like avoid these points in pregnancy because like the acupuncturists say like these can induce labor,
Okay.
but like it's hard to say like if it will for sure. But
What are those points?
there's certain ones. So there's one right here.
Yeah, here.
Yeah. And this is also a good one for headaches that they say can help. Like if you hold here with headaches, and like if you poke in there, it's a really tender spot.
Oh yeah, I can feel it. So that
Yeah,
is supposed to like help induce labor potentially.
that's what they say.
Is it not proven?
I don't know how proven it is. I can't
Yeah.
speak to that, but I just feel
Yeah.
like from a dry needling perspective, they're like avoid some of these points when someone's pregnant because if they go into labor because of you, like
Okay, so postpartum. So you
mhm.
have your baby,
Yes,
you recover.
yes.
6 weeks later, you go to the doctor and they kind of give you, okay, like you're good to go.
Mhm.
What do you recommend that you do right after? Like, are there any specific exercises that help heal the pelvic floor?
Yeah, definitely. So there's things that you can even do, like very gentle, like the breathing before you even go to the doctor. So
Okay.
the way I like to think of it in phases, like the first phase, like the first 1 to 2 weeks, like you're not going to be up to do anything
Yeah.
anyways. Like, you're resting, you're recovering, like maybe very short 5 to 10 minute walks.
Uh-huh.
Then maybe like
Yeah. I can remember I couldn't even do that. I remember seeing people
I,
walking at like a week and I was like, oh, I can't even like sit on my bed.
I try to think back and it's such a blur. I'm like, I don't
Yeah.
even remember what I did. I'm like, we forget about it. That's why we have more children. But
Yeah.
and then, like when you're in that 2 to 4, 2 to 6 week range, that's when you can start moving around more and start doing some of those deep breathing exercises. So things like just laying on your back or laying on your side, starting to do that 360 breathing, getting the diaphragm moving, getting the pelvic floor moving, getting the core contracting gently. So starting with those little things and little postural exercises here and there
Yeah.
before you even get to the doctor. And
Yeah.
then after that 6 week mark, when you have your clearance, so starting to do things at a very low intensity. So maybe like light isometric core contractions laying on your back, getting your lower abs firing, like right down here. Starting with the basics, making sure that you can do that you know how to turn on those muscles without having the diastasis happen, without feeling pressure on your pelvic floor, and then learning again how to engage your pelvic floor, how to use your glutes again. So maybe doing like very basic like glute squeezes, making sure you can do all of that without pain or difficulty, and then slowly
Yeah.
ramping it up.
That
I
is
would say.
great advice because I think I went like all in and I had so much pain in my
Yeah.
upper abdomen that I had to like stop working out for a week. Every time I went to work out again, it was like painful and it took a while to kind of slow down. So I think the gradual is probably
Yeah.
like great advice, especially for me for next
I
time.
have like my little like postpartum workout guide of what to do before the appointment. So like I'll give them that, clear it with your doctor, do some
Yeah.
of this basic breathing, basic stretching exercises before
Yeah.
you see the doctor, and then come see me and get started. So
Yeah.
kind of setting the foundation also before they have the baby of like what to expect afterwards, and
Yeah.
making sure you go through everything sequentially. It's going to be boring at first. Like
Yeah. You know.
you
Yeah.
want to make sure you can breathe correctly, you can get your pelvic floor firing correctly, you can turn your core on correctly before you do all the fun, fancy stuff.
And then whenever you get into like exercising, are
Mhm.
planks a good core exercise to be doing?
They are a great exercise if you're doing them
Okay.
correctly. That's one of those
Okay.
front loading exercises where you're going to have a lot more strain through the
Yeah.
front of your abs. So if you can do it correctly and you're not seeing doming or having
So
pressure, then keep doing them.
and ladies. I did not have a C-section, but my sister-in-law did. And what do you do? Because it's different, right? I mean, you're
Yeah.
recovering from
Yeah, and
surgery.
I mean a C-section is major abdominal surgery. Like
Yeah.
it's no easy task to go through for sure. Like my sister had one for both of her boys, and like
Uh-huh.
her recovery was just completely different than mine. So reminding yourself that you just went through major abdominal surgery, so take it
Yeah.
slow. So those timelines that I said earlier, add on a couple weeks to what to expect for your recovery. And
Yeah.
then, right off the bat, trying to, when you get up from bed, rolling to your side and then get up so that you're not, straining through your abdomen,
Yes.
putting more pressure on that area. And then same thing, starting with breathing. So that alone is going to help so many things get moving and get going. And then once you're at that 6 to 8 week mark is when you can start doing scar massage to the area once, you get clearance from the doctor, once it's fully healed. So to desensitize it, help it get moving better and break up or prevent any other adhesions to the area. And
Okay.
just
And
know
you can do
it's,
that to yourself. Like you recommend
yes.
doing the massage to yourself.
Yeah, so once it's fully healed, you can even, so like if you pretend there was a scar here, just putting
Yeah.
some pressure on it and just like rubbing the skin around in circles, like,
Oh,
and then if
okay.
that's too sensitive, then even maybe start below the scar. You're still gonna pull some of that
Okay.
tissue above. And then you can also do dry needling for it once you're like, 12 weeks plus out. Yeah, you can do dry needling for
I
C-section.
love dry needling. Dry needling is like one of my favorite things
Yeah,
ever.
I love
It
it.
helps my migraines, my like neck pain. So like anything
Yeah.
dry needling for, I will. But that's so it helps. It can help the scar tissue.
Yeah, dry needling for scar tissue, it's awesome.
I also think even for me physically and mentally, it took me about until now to feel more normal, like back
Right.
to myself, maybe when he was like a year and a half. So I always tell people that because I'm like, it's not 3 months. Like,
No.
like that's kind of like when you go back to work, but it's like that's not at all what your body needs physically and mentally to like fully recover. And I'm curious from your point of view as a physical therapist, when do you feel like the body can fully recover from birth?
I always tell people like it took 9 months to grow your baby, so give it at least 9 months
Yeah.
to feel like you're back, and maybe even more than that. Like I believe they say like 18 months is what it takes, like from delivery for your body and your hormones to go back.
That's
So
literally what I felt. I was like a
yeah,
year and a half, like
yeah.
exactly. Wow. Okay. So that's
So
good
it
to know.
does take time. Yeah.
Well, I think the perception, and especially with like bounce back, it's like, oh, they
Yeah.
bounce back. They look like themselves again. They're normal, but you're not.
Yeah.
Internally, you're not, even if you are external, it's like mentally and physically, you're just not the same for a while. And that's okay. And like knowing that, I think,
Normal for you, like your body goes through so many changes. Like you may get back, like I know so many people perseverate on getting back to your pre-baby weight, but like, you may get back to that weight in 9 months or a year or two, but your body's going to be different, your hips may be wider, like your nothing's the same. So
yeah, yes, that is so true. Give
I'm
them
like,
away.
it's a new normal. And like I can say after learning what I did and
Yeah,
how to use your core correctly, like I'm definitely stronger now than I was before. Like, because I was like, I definitely wasn't using my core correctly beforehand. So
that's amazing though. And that's just what like a little knowledge and education, you know what I mean? And like looking at your page, like that's what that can do for people. And I think that is so cool because you can teach them how to really like strengthen their
yeah,
core.
sure. Thank you.
I love it. I love it. I'm
Thank
like, after giving birth, a lot of people do have leaking, and I definitely had that. I'll literally never forget jumping up at one of the postseason games and
Oh
being
no.
like, oh my God, like I have to go to the
We're like, what is going on here?
what is going on? So, and that was like my first ever experience with that. And I was like, what just happened? Like, I didn't understand it, I think, for a little bit. And I
Right.
was like, what's normal for leaking? Like, how long should that go on?
Yeah, so it's definitely common, but it's not normal. Like
Oh,
leaking at all is
not at
not
all.
normal. Yeah. No leaking is the best. Yeah. And it's definitely something like if it is something that you're still dealing with, it's something that you can improve and correct with pelvic floor and all of that stuff. So how much do you know about leaking and the pelvic floor?
Like, very little.
Okay, so I'll explain it. Let me put my
I
model
know
back.
that like you're not like you shouldn't be. I was reading your website, but it said like you shouldn't be going more than 5 to 8 times a day.
Yes.
So I guess it's like it's not fully filling up, but it's
Yes.
starting to come
Yeah,
out.
there's different types of, so the term is incontinence. There's different types. So stress incontinence would be something like what you said when you jump up and you leak urine. So when we jump or cough or laugh, it's a pressure management issue. So all of that increases the pressure in our abdomen. If the pelvic floor muscles aren't strong enough to maintain that pressure,
Yeah.
that's when we leak urine. So these superficial pelvic floor muscles, they should be closed and contracted. So that's what keeps our urine and our bowels in there. When they're weak or maybe too tight and you have that increase in pressure, that's when you get the leaking. So that's stress incontinence in a nutshell.
Okay. So
That
what you're doing through physical therapy and through these exercises is strengthening that like superficial muscle.
Yeah, the superficial and the deep muscles. So
And
here's the
okay.
superficial ones, and then here's the deep. It could also be a tightness issue. So think if your muscles are super tight, they can't be strong either. So if you think of like your tight bicep, like you can't, like how can you lift if you're like up here? So same thing with the pelvic floor. If they're tight and clenched, they can't be strong. So that's where
Why
like
would they be tight? Is that like from like what is that from?
it could be a multitude of things. So after childbirth, if you had tearing, like you could have that tightness issue
Okay.
afterwards. And if you're like, if you happen to be a tense person, so they say jaw clenching and pelvic floor clenching can be interlinked. So if you're a jaw clencher, like check in with yourself when you're clenching your jaw and see what your pelvic floor is doing. So if
That
you,
is
yeah,
good advice. I'm always clenching my jaw. I
yeah,
like
I'm
that's literally
guilty of
I
it too
got dry
sometimes.
needling in there
Yeah,
for that reason because I'm
yeah,
like big jaw clencher. So that's good to know. So kind of check in with your body too when you're
yeah. Like when you're tense, like see, like feel like what your pelvic floor is doing.
so for breastfeeding, is there anything that you recommend you can do to help with pain? Or I had mastitis for a little bit, and I know a lot of people struggle with different things during breastfeeding, but is there anything from like a physical therapy standpoint that you can be doing to like help?
With the mastitis pain or just like neck and other
Kind of
related?
in general, I think kind of every because I just feel like it can get painful. I remember I liked looking at him. I don't know. I
Right.
was like always would like look at him when I was
Yeah.
breastfeeding, which is great, right? Because he's so
Yeah.
cute. And you're like, oh,
Yeah.
it's so
They're so cute.
sweet. But like my neck is like this. And I remember like at one point it was so painful to like move it back up. And I'm like, what? I think it was just the
It'll
constant
probably get,
holding
yeah.
neck and all that. So this was just like,
Yeah, like all of this is in a curled up position. So you
yeah.
wanted to do exercises that help open up the front. So like wall angel exercises, like these always feel so great on the wall, just going up and down.
Just
Um,
standing on a wall.
yeah, like with the wall right behind you, as if I was against the wall. Doing a lot of thoracic rotation work. So you could do it laying on your side or on all fours, opening up through here, just getting your neck moving. And
Okay.
anything that really helps, strengthen the back of the shoulder blades. So,
Yeah.
like scapular exercises, like these type, and then
Mhm.
any like type of neck and thoracic mobility. I'll have to make a video about that now, showing
Honestly, that
exercises.
would be great.
Like I didn't think about
That- yeah, that is something that I feel like it's like a pain that's slow. Like it
slow
slowly
burn.
builds,
Yeah.
like at first it was fine looking at him the whole time. And then he's like, 2 months in, and I've been doing it for 2 straight months, and he's getting a little heavier, and I'm not, supporting my elbow and stuff. And it was like causing so much strain. And I feel like that's something that, again, like I kind of ignored because I got to focus on him, and then I started getting like migraines and stuff. And I'm like, okay, I need to address this problem because I can't keep like hunching like that
Yeah,
anymore.
and the neck causes a ton of headaches too. So like this alone is going to cause all these muscles back here to get tight, and the
Yeah.
neck alone can cause a multitude of issues of headaches and all that
Yeah.
level of stuff. So just if you are feeling those symptoms, I would tell someone like go see a physical therapist to get it worked on as well, rather than just trying to handle it
Yeah.
on your own.
Well, thank you so much. I appreciate your
Awesome.
time, and I really do appreciate you doing this interview. It was
Of
so
course.
fun.
Yeah, thank you for having me. If you have any questions or like ever want me to show you how to do things correctly, I'm more than happy to help.
Thank you. We'll talk
You're
to you soon.
welcome. All right, bye guys.
Bye.